welcome to Let's Talk, our podcast series produced by Hazel and Betty Ford for you, our viewers and listeners. I'm your host, William C. Moyers, joined today by my colleague, Bob Poznanovich. Our topic is well-being and wellness in the workplace. Welcome, Bob.
Thanks, William. Nice to be here.
Thanks for being here with us today. Tell us just a little bit before we dive into the subject about how you got to Hazelden.
Well, it was in 1995 after a run using cocaine in the 80s and 90s when cocaine wasn't supposed to be addictive, and then it became addictive all of a sudden. It was after I lost a big job in a Fortune 200 company that I know I needed help, and ended up doing my research, and Hazelden was the place to go. And in February of 1995, I entered treatment. And it'll be 28 years here in a few weeks, and I've been sober and clean ever since.
Wonderful. And then how did you actually end up becoming an employee of Hazelden?
Yeah, that's an interesting story. You know, I was a very active alumni and volunteer, and then I went back into the business world, and we took a company public, and I realized that selling things that didn't matter wasn't important to me anymore. You know, and I realized that my family and my employer and I made a lot of mistakes when I was struggling. And I'd opened up a business that was in the behavioral health space that helped families and organizations, deal with addiction and substance use. And after I sold that company, there was an opportunity to come and join Hazelden. And I said, I never want to work at Hazelden. I said, I volunteer here. I'm an author. I'm an active alum.
A donor.
And I'm like, the last place I want to do is end up having a career here too. So the former CEO asked at least if I'd help on a consulting basis, and now that's 14 years later. And I'm still here. I said I would never work for Hazelden, so never say never. I said I'd never be an alcoholic and a drug addict either. So,
well, and we're glad that you're here because you did really bring in a critical perspective to our mission, which is all around the engagement of the business community. Let's talk about Hazel and Betty Ford and what we're doing these days in the business community.
Yeah. So, for my own personal story, I found out after I got fired, and I was an executive of a Fortune 200 company, and I had $1 billion of responsibility, that my company had 50 meetings about me, but never a meeting with me until the day they fired me. And I found that out years later when I met our HR vice president at a conference. And he goes, "Oh, Bob, I'm glad I heard you're doing well, et cetera." He goes, "We didn't know what to do with you." In retrospect, if they would have talked to me just once and said, "We're concerned about you," I would have ran and got help. Because so much of what I was who I was, right? So, because they didn't know what to do, I didn't know what to do, and everything got worse, and I ended up getting worse and worse. So, for many years, when I got into my own space, my own business, the goal was to work with corporations to address the problem that they have. And we didn't get a lot of traction. In fact, you may remember 20 years ago or whatever it was that you put on an event in New York City trying to make addiction America's business.
Yes.
But we never got a lot of traction, even though it was really an important topic. And I think part of the reason is denial. I think part of the reason has been how do organizations look at substance use in the workplace. And I think maybe the biggest reason is stigma. That as an employer, I don't want to admit I have employees who could be struggling with substance use. And as an employee, I can't take the chance to say that I'm not okay.
Yes. Because
of fear of retribution. Our research at Hazelden would say that I'm so afraid of retribution that I won't even ask for what my benefits are, let alone ask for help. But I think the tide is changing, and now is the time.
Why is the tide changing?
I think, two things happened that really changed the dynamics in the workplace. One was the opiate epidemic, where it was hard to deny when you had people literally dying on the workplace, floors in the workplace, whether it be in the factory or in the office, who were using prescription opiates or heroin more frequently than they ever did in the past. And then the consequences were there were overdoses happening in places they didn't happen before. So that was one that people saw very graphically in their workplace. Number two is as people got addicted to opiates, they ended up either in the hospital, in the emergency room of the hospital, or in treatment. And when many went to treatment, they didn't know how to navigate healthcare and ended up at maybe the wrong place. That was really costly. So all of a sudden, organizations who didn't think they had a problem before were now starting to see the actual results of somebody, overdosing right there, or all of a sudden the healthcare costs were going up. That started it. The second thing that made it worse is COVID. which is probably, many think it's the most psychological trying event that we'll ever have in our history, for sure up to this point. That there are more people struggling with mental health and substance use than ever before. Last year we had more people die of alcohol than ever before. So I think the workplace recognizes that 20% of the people today that are working are struggling, and the people coming back to work aren't like they were when they left work. They're in much worse condition. And what do? You've got a workforce that is struggling, who's 20% of the people have admitted that they're drinking during work, and actually on Zoom and WebEx phone calls, that the workplace has to remain competitive, right? So we have to be able to recruit people. We've got to manage healthcare costs, and we got to create a healthy environment. And now behavioral health is rising as an important factor in achieving all that in the workplace. So I think they can no longer kind of just say, we don't have a problem. What we're noticing is more people recognize they have a problem. Now they're trying to figure out what's the right thing to do.
And before we go to that, what's the right thing to do? There is a popular misperception in this country that most people who struggle with substance use issues or mental health are not employed, but in fact they are employed.
Right. When I would talk to organizations prior to, recently, over the last 20-something years, they would say, we don't have alcoholics and drug addicts at work. And I would say, how would you know?
Right.
And they would say, well, they're not accessing treatment or they're not accessing EAP services. And I'd say, all that just tells me is they're not accessing treatment or not accessing EAP services. It doesn't tell me you don't have alcoholics and addicts working here, or that you don't have employees whose family members are struggling.
So let's talk about what specifically you're leading as an initiative at Hazel and Betty Ford around this well-being portal.
Right. So, the workplace, when you talk about, William, you said that, going back to what you said, that the misconception is that people struggling from drugs and alcohol don't work here. And the fact that's just wrong. 70% of the illicit drug users and 80% of the alcoholics are employed full or part-time. So the problem does exist in the workplace, right? And the workplace actually covers more healthcare costs than the government does.
Interesting.
And employees actually will trust the workplace more for health recommendations than other people. So when you say, what's the problem, what's the opportunity? I think we see that the workplace could change behavior. Let me look at smoking. Years ago, you got to work, you got your desk, your accessories, a phone, a pen, et cetera, and an ashtray.
Yes.
Right now, you can't smoke on campus. In some places, like the Cleveland Clinic, you can't even smoke. You can't even be hired if you're a nicotine user. So we've changed behavior. So I think what we're seeing is organizations now are looking at how do they expand services in wellness to include behavioral health, and substance use, and mental health. And the first thing that we started to do was for organizations to recognize the need to help their employees navigate good care. And it started with many of the payers. In fact, almost all of the payers have identified their top providers as quality and outcomes and created a center of excellence strategy, which...
And hold on, when you say payers, you mean insurance companies,
right?
Yes, okay.
Insurance companies and managed care organizations, and even some EAPs have recognized their top performers as in quality, patient satisfaction, and outcomes, so that they could provide some guidance to their members or employees on where the right place would go if they were looking for help. That in itself, though, isn't enough with the size of the problem, because we have a lot of people in the workplace today who are also at risk, meaning they're not necessarily right now using at what would be dependent levels clinically, but there's a problem. That if they don't get help and it continues to proceed, they'll get worse. The other challenge was, how do we get more people engaged and more people comfortable about looking into resources? And having worked with some employers, having worked with some EAPs, having worked with some insurance companies, having looked at it in our own patient navigation, we recognized that there was an opportunity to add resources to all of the existing infrastructures that happen in the workplace around well-being and wellness that specifically talk to substance use and mental health, that gave individuals who might be looking for resources for themselves or for resources for others an opportunity to anonymously come to a website, answer some questions, get some interaction, get some feedback, and get some, using some of our intellectual properties, have kind of a decision tree, say, based upon what you shared with us, we're going to recommend some solutions for you, many of which would interface to the existing benefit plan of an employer.
Yes. Oh, interesting.
So we built something called the Workplace Wellbeing Portal. It's something that we spent over a year developing with over $1 million in funds donated by donors to, who understood the challenge and the opportunity and the need to help the workplaces. And what we're doing now is providing an on-ramp, if you will, for employees, dependents, the organization itself, to allow them to expand their benefit package. So the employees get a portal that allows them to get educated, get information. It allows them to take some screening questions to understand where they're at. It allows them to take that information from screening and make some recommendations on care, and it helps them navigate the entire health system and hopefully get them into action. And it's geared towards three types of people. Those who think they might have a problem, those who know they have a problem and need help, and then another really important area is those who had a problem and took care of it and want to remain in recovery and want to release resources.
Yes.
And I think that also has a really potential important role in changing the culture in the workplace. And that is creating recovery communities within the workplace. The Department of Labor just came out with an initiative called Recovery Ready Workplaces, where they're raising the visibility. They provided a kit, and they're trying to encourage workplaces to recruit, retain, employ, and support employees of recovery because it's the right thing to do, but it's also the right thing to do from a business and a competitive perspective.
Yes.
That, in speaking to the Department of Labor in the office on drug, the drug czar's office, they indicate that one of the reasons that we have such great unemployment right now is that there's so many people struggling from substance use that they're not healthy enough to work. So being able to retain, recruit employees who are in recovery becomes a competitive advantage as well as the right thing to do from an organization wellness, healthcare costs, et cetera. So we're hoping that through this portal, through these resources, through the tools that we can provide organizations, that not only that they help the people that might need help, but we bring more resources to those who already got help, and that we take away some of the stigma that allows me to come, to put a face on recovery as a term you used to use for years.
And how do you assure people who access this workplace well-being portal that it is in fact confidential or anonymous?
Yeah, well, we built it, in our system in a way that we're not looking to monetize the engagement. So if you look at a lot of websites, say you go somewhere, the first thing they want is your email address, right, or something so they could contact you and monetize you. We didn't implement any of that. You don't have to give us any information about you until you're ready. Or not at all.
Right. Or not at all. Yes.
And the workplaces could implement it just that simply. We could add it onto our website so that it is not part of the company's website. An employee comes in, they get a message that pops up that says this is anonymous, and allows them to access the service without fear of retribution. In other cases, some of the organization is doing that, and they're also embedding it into their well-being portal too, so that it's consistent with the other resources. So I think multiple points of entry is one of the keys to the success. Let the employees kind of walk in whatever door they want to walk in.
Yes.
To get the information. And then within that portal, we're looking at expanding the services too. So we talked about that at-risk users, right? 20% of the people right now drinking who are at risk levels, meaning that if there's not some form of an intervention, they'll most likely get worse, not better, right? So we're putting online self-help tools that are self-guided, self-administered, that can be done confidentially, that allow people to take some online courses that are evidence-based that will help them reduce their drinking. And there's a lot of studies that show that some of these interventions work and will reduce a at-risk drinker to non-at-risk levels, right? Which would be the ultimate goal, right? Is the early intervention and prevention. So thinking about that continuum that we're trying to bring is those who might be at risk, we want to get them help early. Those who know they need help, we want to get them help now to the right place. And those who got help, we want to keep them in recovery and that maintenance and continue to encourage their involvement. And hopefully that we take our tools and our brand and our resources and our ability to create communities and help organizations create their own communities. Years ago, one of the organizations that used to do that was United Auto Workers, that really embraced 12-step recovery and used to let people have AA meetings right on the assembly floor. So hopefully we could get to that point, in America, that we're not afraid to be in recovery. Is
the workplace well-being portal, is it accessible if you're on the business side? In other words, if you're an HR director or an EAP or the CEO, can you go in through the portal too?
Yep. So we're working with a lot of different entry points to get the products into the marketplace or accessible to the employees. So one is we're working directly with some of the employers who are who are adding it on to their set of services. We're also working with insurance companies who are taking the product and the content. We've got 75 years of content.
Yeah.
Right? We're really known for having tremendous amount of resources for individuals and for families, for substance use, for mental health, for those struggling as well as those in recovery. So we really package the best of the best and put this into a easy to navigate format. But we're finding other usages for it. So one is the website that we created itself, the portal. But other organizations are taking the content as well and putting it into their systems or their infrastructure.
Okay.
So we're going directly to employers. We're taking our content via insurers and managed care organizations. We're also partnering with benefit design and consultants who are putting together solutions for workforces and really trying to look at a comprehensive strategy for the workforce to say to workplace, how am I going to address substance use? How am I going to address mental health?
Yes.
It's a combination of access to resources, digital resources. It's an access to good care, and it's putting recovery strategies in place for those who get care to try to expand those relationships.
We've only got about 2-3 minutes left, Bob. And as it relates to resources, talk a little bit about the reality that insurance, private health insurance does, for the most part, cover substance use treatment.
Yeah, I think because of the work that you and advocacy professionals across the country have done, with parity, we have really great coverage now within the U.S. for healthcare. It's one of the 10 essential diseases that need to be covered, by healthcare. So 97% of the people that access us today have in-network benefits provided by the employer, which is important. That's why the employers have to be involved in this. The problem exists, right? You have people struggling, you have dependents that are struggling. You're already covering the cost, and this is a hard disease because without giving the resources to employees, what we're saying is that the same sick mind that got me into this problem has to someday be healthy enough to get me out of it.
Yes.
Then I got to figure out what I need, and then I got to navigate healthcare.
Yes.
And if they could make this easier, considering the fact that the workplace covers most of the costs, they've got most of the problem, and people depend on them, I think it's a tremendous opportunity to do the right thing, right, and make the organization more competitive at the same time, which impacts the bottom line. But the real bottom line is that they'll ultimately save some lives.
So, Bob, you talked about people who might be struggling with a substance use or mental health issue, certainly finding these resources. But what about the family?
Yeah, great question. So this targets this well-being portal, not only the people who are struggling themselves, but we intentionally also provided a lot of the resources for families. Because part of the population that's struggling is not only the employee, but their dependents. And part of the cost that an organization has to pay is for the total health care of a family.
Yes.
So we put the same resources that we put for individuals who are struggling in place for the families. So families have their own educational materials. Families have their own screening tool to kind of help them identify and see how enmeshed they are and how much they're struggling as well. And then we give families paths to resources themselves. Because they might have a family member who's not maybe ready to have the conversation with a loved one, but is impacted by that one. So we give them resources, how to take care of themselves, how to have the conversation, how to get the unhealthy family system, into the healthy family system. And then if their loved one's in recovery, we provide resources for the family so that they could be in recovery themselves too. So we really address both the family members as well as the individuals that are struggling through the portal.
Two questions before we go. So where do people find this workplace well-being portal?
You mean those who are interested in potentially using it? They would get a hold of us in our business development team. We have a team of professionals on my team who are working with employers and the points and the groups that work with employers to provide custom solutions for them. It could be deployed really quickly. It's not a big investment at all. It doesn't require a heavy lift from a technology perspective. It's just more of a decision that says we want to take this on and make this part of our well-being strategy.
Yes, okay.
To do so.
Okay, and we know, last question, that on these Let's Talk podcasts that we've been doing for years, that oftentimes we get, or inevitably we get viewers who are watching them or listening to them because they or a loved one has an immediate acute problem. What is your message to somebody who is employed, has had a successful career, but is struggling with a substance use problem, or has a family member that's struggling with a substance use problem and is worried about losing their momentum of their careers or losing all that opportunity that they've created?
Yeah, I think the reality is what most people know about addiction is wrong. So many of the myths have kept a lot of us sick, right? Which, the one that stands out the most is that, you can't do anything to help an alcoholic until they hit bottom. Right? Think about that.
Yeah.
In no other disease in the world would we say somebody has to get worse before they get better.
Yes.
In fact, it's actually cruel.
Right.
Right?
Right.
So I think that the important thing for everybody to remember is that this is a disease of the brain, and that nothing can be gained by waiting. It's only going to get worse. Mm-hmm. But you're not alone. I mean, here's the reality of what we're dealing with. Think about this. Take out the word addiction. This is a disease that impacts 1 out of 8 of us. That 2/3 of the country are impacted somehow. It costs billions and billions of dollars to society. Yet only 1 in 10 people are struggling to get help. If you didn't have the word alcohol and drug addiction, the society would be enraged over those kind of numbers, right?
Great point.
So it's stigma.
Yeah.
Right? Somehow we look at this different, and it isn't.
Yes.
Even when we're sick, we deny we're sick. Then when we realize we're sick, we often don't want care.
Yeah.
So we just got to change that. Maybe we're responsible for taking that first drink or that first drug, right? But we never decided to ruin our lives, right? Some of us just get the DNA is right. Things just happen just right. Then instead of going left, we go right, and we ended up being addicted. So it's about recognizing today that we need care, but and asking for help is a little bit hard. But I think if you got that right environment in the workplace, where they welcome you, I think if we could get to the point that we're okay with you not being okay,
right?
Where I'm okay with not being okay. That we can move forward. And again, when you look at the reality of this, 2/3 of the country today understands what recovery is and what substance use is. They're impacted somehow. So we're not as isolated as we really think we are. Right. We're not as different as we really think we are.
Yeah.
And now the next step is for the workplace to embrace this disease like they have other diseases, other chronic diseases, and provide the same resources. If I was in the workplace and I needed to have dialysis, I'm sure they'd give me time off. If I was in the workplace and needed to go to an AA meeting, would they? So just a little bit of a culture shift to allow us to come out on an equal with other chronic diseases that are going to affect the quality of my life and the quality of those lives around me.
Bob Poznanovich, I've known you for a long, long time, even before you and I were employees of Hazel and Betty Ford, and you've gotten to be good, man. There's a future in you, and if you ever want to be a podcast host, let me know, because I think our executive producer, Lisa Stengel, and I can make it happen.
We'll keep that for you and Lisa, but thank you for having me again, William. Appreciate
Thanks a lot, Bob. And thanks to all of you for joining us today for another edition of Let's Talk. Make sure you tune in again to talk more about the issues that matter to Hazel and Betty Ford and matter to you too. Take good care.